Welcome to The Little C and Me. I'm Opal McKnight Klein-Sasser, a stage 3 breast cancer overcomer who chose a different path. No chemo, no radiation, no hormone treatment, just real change. Here, I'll share how diet, exercise, mindset, and determination helped me overcome breast cancer, lose 55 pounds, and live stigma-free. Join me as we discuss ways to live long and live strong. Hi, this is Opal McKnight Klein-Sasser, a twice breast cancer overcomer. I'm here today to talk about symptoms of breast cancer. I will go back to 2020 because that year is very pivotal in my mind. So coming back from my mom's funeral, December 2020, about April or so, sometime in March, when I came back, actually, there was a boil, and being Jamaicans, we normally dress the boil or nurse whatever it is before we actually go to the doctor. And so I had bought this thing called black dressing, and now that I've read that black dressing is for horses, but I had boils growing up as a little girl, and my mom would put the black dressing on it because of sensitivity or allergy to insect bites. So she used to use the black dressing for the boils. And of course, I bought one when I went to Jamaica for my mom's funeral. And I had the black dressing, and there was a boil under my left breast. And so I put the black dressing in it because that's what I know to do. Long and short of the story, there was a hole under my chest. And so I started panicking, and I stopped using the black dressing, and I went to the doctor and I told him, hey, it's oozing pus. And so they did a partial lumpectomy or whatever it is. They took out the thing, it stopped oozing the pus, and they tested it wasn't cancerous. Fast forward to about July, right breast. Started having pains in the breast, and the armpit. I went to the doctor and I told him, hey, I'm having pains in my breast, like the pain in the other one. And it was like, he brushed me off and said it was probably tight undergarment. I was a 38 triple D. I had no reason to be wearing tight undergarment. And so I left his office. Of course, again, being a Jamaican, I hissed my teeth. And I said, tight undergarment, my backside. Because that's how we talk in Jamaica, or we used to talk in Jamaica. And I left his office and I went, and so the pain increased, especially when I ate certain things. I love plantain chips and I love soda, and I would drink a lot of island soda. I would go to Walmart. I'll buy 3, 4 every Saturday, and by Sunday there will be none because I just loved soda growing up. And the more I drank the soda, and I love patty and jerk chicken and all of those things, and the more I ate them, the more pain I felt. But I continued eating them. So I like soda, especially cola champagne, one of the best sodas out there. Again, my opinion, but anyway. Even my husband liked cola champagne, so we normally bought cola champagne when we go to Walmart. It was cheaper than the other places. And I would drink cola champagne. I would eat ice cream. I would eat like half tub of birds. Yeah, ice cream was my go-to comfort food. And the more I ate them, the more I felt the pain in the breast and in the armpit, right? And I was rear-ended twice, once in Jamaica, once here in Canada. So I also had back pains. But I would still try to do my little exercise that the physiotherapist gave me. And the more I did the exercise, especially one on your knees, I think it's called dog something, and you go on your knees and you stretch out one of your hand. And every time I stretched my right hand, it would pain me. And so I gave up on the exercise. And I was telling my friend about it, and she said, go back to the doctor. And so I went back in October, and I said, Doc, I came here a couple months ago. I told you that my breast was hurting me, and you said it was tight undergarment. Well, it hasn't stopped. At that time, I was still breastfeeding. My son was 2 years and something. Yeah. No, at the time, I think I stopped breastfeeding. Yeah, I stopped breastfeeding, but I didn't go for a mammogram or anything. And so he said, when was the last time you did a mammogram? I said, I haven't done one because I was breastfeeding up until December 2020. And so he sent me for the mammogram. The technician was saying to me that, this doesn't look, something looks off and I would need to do some more tests. I did some more tests, and that's when I found out that it was breast cancer. And as a matter of fact, I did maybe about 4 mammograms and 3 ultrasounds, and then the biopsy. And and there was still so much pain. When I say pain, I mean pain, real pain, hurting in the breast. And I remember all those biopsies that I did. And I promised myself I would never do another, not biopsy, mammogram, and how they squeeze the breast and telling you that they need to get everything. And again, remember, I was a 38 triple D. So it's not that I had a little breast. I had a lot of breasts. And they would put it on the thing and they would clamp it. And I remember that. So much pain I would be in. I didn't want to cry because I didn't want my husband to see me crying. I know it was hard enough for him to deal with. And so I had to deal with the pain. And I dealt with the pain. And then the biopsy pain again, because again, the pathologist or whatever they're called, the person who did it, she was telling me about the dense breast, being a black person. She didn't want to say, but hey, black is black. And that's just the reality. So being a black person, I had dense breast. And dense breast means, again, a lot of muscles in your breast and so on. And the pain. And even though I'm black, there were still some little bruising on my breast from the biopsy. And they said it would take a couple of days for it to clear. And so I continued with the pain. I lived with the pain. I lift up my arm, there was pain. And I know people say that breast cancer, you don't feel any pain. Everybody's body is different. I remember when I was telling a friend of mine about the pain, and she was saying to me, it's not cancer, because they said cancer don't pain you. And I believed. But for my situation, it pained. It pained a whole lot. My armpit pained, my breast pained. And then after the diagnosis, that's when I realized that why was the reason my armpit paining me? Because there were cancerous tissues in my lymphatic nodes. So for those of us who are feeling pain in your breast, don't ignore it. Don't let nobody tell you that it's not cancerous. Go and have it checked out. You want to squish your breast under the mammogram thing? That's fine. For me, ever since then, I've chosen to do an ultrasound. And it was an ultrasound that I did in October 2024 that they saw some suspicious mass, lump, tumor, whatever they want to call it, in the breast. And that's how I realized that the cancer had come back. So what I'm saying to you, not take it for granted. You feel one little tingling of pain in the breast, go check it out. You feel a lot of pain in the breast, run, go check it out. But whatever it is, the breast or the body has a way of telling us that something is wrong. And don't do what I did. I sat down there for months with the pain because the doctor thought he knew what was happening to my body. It is your body. The Bible says every heart knows its own sorrow. And in Jamaica, we would say, whoever the shoes are squeezed, them know it. If the shoes are squeezing your foot, go to the doctor. If that doctor don't want to do anything, find another doctor. And that is what I should have done. I should have advocated for myself, because if I did, maybe it wouldn't have reached stage 3. Maybe it would have been stage 2. But it was stage 3 by the time they found out what was happening to me. And by the time I did surgery, it was stage 3. They took out 18 of my lymphatic nodes. 6 of the lymphatic nodes had cancer in it. I'm just saying to you today, you're feeling pain in the breast? One doctor run off his mouth or off your mouth, his mouth or her mouth, find another doctor. There are many doctors out there. Find somebody, let them know what is happening. Tell them how long, and nobody sit down and bear the pain. Don't. I did that. And if I'd bear that a little longer, maybe it would have been stage 4. Because they stage it based on the size, Not necessarily it's spreading to your organs like your kidneys and your liver and your bone. No. The staging, as I read, and if I'm wrong, you can send me a message and correct me. But the staging also has to do with the size of the tumor or the mass or the lump. And for mine, it was stage 3. Came back again, it's still stage 3 because of the size of it, because they measure it when they're doing the ultrasound. So I say to you, my sister, my brother, whenever you feel any little pain in your body, especially for us women, in your breast, go to the doctor. Tell them what's happening. Even if they don't feel anything, and most of the time they're not going to feel anything, ask them if you can do a test. Tell them you want to do some tests, you want to do something. Don't sit down and bear the pain. Because by the time you sit down and bear the pain, it might spread to your liver and your organs, and then it's going to be too late. So thank you so much for listening to me today. Stay tuned for the next episode. And what we're going to talk about in the next episode is going to be nutrition. Thank you so much for listening. We'll catch you another time on the Little C and Me podcast. Thanks for tuning in to the Little C and Me. Remember, overcoming breast cancer is possible without fear, stigma, or compromise. Find more tips on our YouTube channel, Setting You Up for Life After Breast Cancer. Join me next time for more ways to live long and live strong.